Yep.
Hello everyone, my name is Angie and today my partner Quentin and I will be doing our debate on cannabis. Our proposition is that cannabis should be a legal medical option. We believe this because the plant itself, as well as concentrated extracts of the various of cannabinoids that constitute it, can be applied safely and effectively in treatments for the symptoms of cancer, AIDS, HIV, multiple sclerosis, pain, glaucoma, epilepsy, asthma, migraines, arthritis, Alzheimer's, and psychoactive conditions. THC, or also known as tetrahydrocannabinol, is the chemical responsible for most of marijuana's psychological effects. THC changes behavior by binding, fitting together like a lock and a key to receptors on your nerve cells, which then responds with a change in your activity. We believe cannabis should be subject to the same research, consideration, and study as any other potential medicine under the standards of the U.S. Food and Drug Administration, also known as the FDA. Legalizing cannabis for medical use should not be decided by legislative or voter initiative. Marijuana is considered a viable treatment option by many reputable professionals within the medical community, not because it has been used medicinally for thousands of years, which it has, but because of numerous peer-reviewed case studies. And as all you know, marijuana is one of the most common drugs, and according to the U.S. Department of Human Health and Services, the number of people in the U.S. who admitted to smoking pot for medical purposes climbed from 14.4 million in 2007 to over 18 million in 2011. Based on the Department of Licensing and Regulatory Affairs, as of May 31st, 2008, there were 128,441 active registered qualified medical marijuana patients, and a couple of the states in the U.S. legalized this as a medical option, but not all the states are for it, so. I just wanted to make sure that you guys knew our proposition as having marijuana for a medical option only, not for recreational use. And so Christopher Largan explains that the issue is not about the laws, but it's for the sick patients, and legislators aren't healthcare professionals and patients aren't criminals. Medical marijuana prohibition is irrational. Founder of the Autism Society of America, Bernard Rimland, wrote that it is important to distinguish between legalizing marijuana for medical uses and recreational drug use. Early evidence suggests that in such cases, cannabis may be a beneficial treatment as well as less harmful than the routinely prescribed drugs by doctors. And I try to do a lot of research on searching about the proven facts of marijuana being the cause of somebody's death or any fatalities. And according to David L. Bierman, a physician and medical marijuana expert, says people have been trying to find major risks from marijuana, but I've never seen any documented. According to Lester Grinspoon, professor of psychiatry at the Harvard Medical School, there have been no reported cases of lung cancer or emphysema attributed to marijuana, and cannabis has been smoked widely for more than 4 decades. Many of you might not know the risks of marijuana, but in a study in 2012 at University of San Francisco, they calculated that smoking marijuana every day for 20 years has no effects. This is said by Mark Pletcher, an epidemiologist. Now, there are different types of benefits that marijuana is used for, and Senior Medical Advisor Ethan Russo explains that even a crude low-grade product provides effective symptomatic relief of pain, muscle spasms, and intraocular pressure elevations in selected patients failing other modes of treatment. Marijuana use can relieves certain types of pain, nausea, vomiting, and other types of symptoms of illnesses, and it is indeed less toxic compared to other drugs that physicians prescribe every day, which may be synthetic. Robert Townsend, an osteopathic physician of more than 20 years experience, says that his patients with chronic pain substituted marijuana for their narcotics, and it reduced a lot of their pain management, whereas patients who didn't use it had to use a lot more narcotics to treat their symptoms. Colin Blakemore and Leslie Iverson, which are professors at the Oxford University, explained that unlike for nicotine, alcohol, and hard drugs, there is no clear defined withdrawal syndrome when use of marijuana is stopped. The different types of illnesses marijuana can cure is arthritis, Alzheimer's, migraines, and psychological disorders. According to Thomas F. Denson, those who consume marijuana occasionally or even daily have lower levels of depressive symptoms than those who have never tried marijuana. Specifically, weekly users had less depressed mood, more positive effect, and fewer somatic complaints than non-users. It also helps cure HIV and AIDS, and according to Kate Scannell, which is a director at Kaiser Permanente in Northern California Ethics Department, says that working with patients that have AIDS and cancer, she has repeatedly saw how marijuana could help a patient that's having fatigue, or restoring their appetite, diminishing their pain, or helping their vomiting and nausea.
I'm going to cut you off, Angie, because it's 7 minutes.